The next special population that we have to take into consideration when training clients is when a client is suffering from a knee injury. That can come in any form, such as ligament damage, sprains or strains, arthritic pain, fractures, many more. First off, you're definitely going to have to get your client to get some medical clearance. That way you can see what you can and can't do as per doctor's orders. That way the client's getting the most out of their training and hopefully being able to recover effectively and gain some strength back in that knee. The primary focus on training a client with a knee injury is to strengthen the muscles about the hip girdle, the ankle, directly about the knee, and also in the core. That way you're going to be able to stabilise the joint. It's also a good idea to test flexibility ranges of the lower extremities, just so you can measure how far that the client can go, and you'll also be able to show them how far they've come basically in terms of when they're at their most injured and when they're starting to be able to recover. So it's always good to keep a record there. I know a lot of clients suffering from injuries do struggle a bit with motivation and do feel a bit down in the dumps, so it's always good to have these little checks so you can show that they are gradually improving. First off, when training clients, don't put too much stress on the affected area, so you won't be doing any exercises like leg extensions, weighted squats or plyometric activities. Otherwise you avoid injuring the knee further because it's moving too far out of its comfort zone at that stage. You have to be very careful and treat it very carefully as well. What you can do, basically when you're training a client with one limb weaker than the other, you do have to work both opposing limbs, so both arms, but in this case it's both legs because of the knee injury. You have to work it so that the weakened knee gets the same weight as the strengthened knee. That way your body's not going to be out of balance, and you're also helping your body not focus on relying too much on that good knee. So you're keeping your balance in check there. So what you would be doing, for instance, would be single leg curls, curling the affected knee first, and then switching over, doing a set on the other knee with the same weight and the same amount of repetitions. Another good thing to do to strengthen the ankles is to use resistance bands and get your plantar and your dorsiflexion in. That'll be help in strengthening the muscles about the ankle. And you can also work and do some calf raises and whatnot as well. Another good thing to do, you can't jump in and do leg extensions straight away obviously, but you can use foam rollers as you get medical clearance for the injured client to actually they can lie back, put the foam roller under their knee, and they can actually extend their knee as far as they can without feeling too much pain, and the foam roller supports the knee, so that way there's a low risk of it slipping out of place and whatnot. But as I said, you do have to be careful with that one. Make sure you're spotting your client appropriately and that you've gained the appropriate medical clearance. What else can we do? Another good one is a Swiss ball squat. Once you have gained a bit more strength about the knee, you can sink down with the ball supporting your back. They can sink down and get a better range of motion. With that, having that ball, they've also got that extra bit of support there, as long as you're spotting the client, helping them up as they need it, and making sure that they're not going too far above their comfort zone. Basically, when they've got these kind of injuries, it's a good idea to stick with sort of machine weights, I think, at this stage until the knee becomes strengthened. So that way you can do your big muscle groups like your chest with your pec deck fly machine, do your lat pull downs and whatnot, still getting the bigger muscle groups. That way they are building muscle, being able to continuously burn calories and whatnot. And a lot of core exercises don't involve too much knee movement as well, so you can get down and you can do crunches and sit-ups on the mat. You can also do your dumbbell side bends and whatnot. So basically that's a really good way of helping out clients who are suffering from a knee injury. Just be careful and make sure you spot them, and don't push them too far.